Let's continue our discussion on the Zhang organs. In particular, let's talk about the spleen. Our discussion on the spleen will revolve around these two key points. First, the physiological functions of the spleen, which includes governing transportation and transformation, governing ascent of the clear, and that the spleen controls of the blood. The second is the systemic relationship of the spleen, which includes the spleen is related to the muscle in the body constituents and dominates the forelimbs. The spleen opens into the mouth and shines at the lips. The spleen corresponds to thinking and emotion, and saliva is the fluid of the spleen. The spleen is located under the diaphragm in the upper abdomen and left upper corner of the stomach. There are three physiological functions of the spleen: governing transportation and transformation, raising the governing the blood. The systemic relationships of the spleen with the body are as follows. The spleen governs the muscle of the body and forelimbs and is associated with thinking and emotion, with mouth in orifice, and with saliva in secretion. Now let's go to the physiological functions of the spleen. Its first function, governing transportation and transformation. The spleen is in charge of transforming food and water into essential substances and transporting essence to the viscera, as well as the tissues all over the body. There are two aspects about this: transforming and transporting food, and transforming and transporting body fluids. So transforming and transporting of food. Spleen can digest the food and absorb its essential substances. The spleen can take part in the different stages of food digestion. First, the spleen chi promotes the digestive function of the stomach and small intestine. After entering the stomach and small intestine, the food is digested and absorbed. This process actually takes place in the stomach and small intestine, but it must depend on the promotion of the spleen chi. Second, spleen chi promotes the absorption of stomach and small intestine. Stomach and small intestine can digest food into the essence and absorb the essence and transport them to the whole body. The absorption of essence by the stomach and small intestine must depend on the function of spleen chi. Lastly, the spleen chi sends up the essence to the whole body. Due to the fact that body fluid and food are not only the chief source of the nutrients which a human being needs to keep life activities, but also the material basis for producing chi and blood, CCM believes that spleen provides the material basis for the acquired constitution and is the source of producing chi and blood. When spleen chi is abundant, so are the chi, blood, and body fluids. The functions of viscera and meridians will be normal. If the spleen loses its function in transformation and transportation, clinically there will appear the manifestations of abdominal distension, diarrhea, anorexia, lassitude, emaciation, and so on. Next, let's discuss transforming and transporting the body fluids. Transforming and transporting the body fluids refers to the function of absorbing and transporting the body fluids to avoid fluid retention inside the body. During the fluids to lung and kidney and excretes them out through sweat and urination. When the spleen functions properly in transforming and transporting the body fluids, the pathological stagnation of the fluids may be avoided and the equilibrium of water metabolism of the body will be maintained. On the contrary, if there is a dysfunction of the spleen in transforming and transporting the body fluids, it will lead to stagnation or accumulation of water in the body and result in the syndrome of damp phlegm or stagnant phlegm and even edema. This is the mechanism of the development of damp syndrome, phlegm syndrome, fluid retention syndrome, and edema resulting from deficiency of the spleen. The two aspects of transforming and transporting the food as well as body fluids by the spleen are interrelated and inter-influenced. The disorders between the two often appear at the same time pathologically. Thank you for your attention.
Interviewing: skin, hair, nails. Generally speaking, the skin is under the overall influence of the lung. The hair of the head is under the influence of the kidneys, and the nails are an aspect of the liver. In practice, though, there are many other relevant aspects, in particular, the condition of blood that affects these types of tissue. The skin is nourished and moistened by the blood and gin. This means that imbalances manifesting in the skin are more often blood imbalances and patterns of dampness, rather than being lung imbalances. All channels traverse the skin. Changes in the specific areas of the skin can therefore also relate to imbalances in specific channels. If the skin is dry, it will be because the skin is not nourished and moistened. This will therefore be a sign of shui shu or jin shu. Oily or greasy skin can be seen when there is dampness, damp heat, and phlegm. The skin can become dry and flaky when there is blood stagnation in the area below it. This is sometimes seen in the area of joints that have blood stagnation. Blood stagnation can block and thereby prevent fresh, nutritious blood from circulating in the skin in this area. Damp heat and phlegm can manifest with greasy or oily skin. Itchy skin will indicate the presence of wind in the area. It is important to identify the cause of the wind. There will often be a combination of both exogenous and internally generated wind simultaneously. Internal wind may arise from the factors such as shui shu or shi heat. Exogenous wind can be both wind cold and wind heat. Other factors that can be involved in itching are blood stagnation, dryness, and dampness. It is important to observe and ask about the other qualities of the skin, such as color, moistness, texture, and so on, to be able to differentiate the etiology. The hair. The hair on the head is created from kidney jing, but nourished and moistened by blood. This means that the quantity and quality of the head hair can be influenced by both blood and jing. If there's jing shu, there can be baldness, a receding hairline, and a thin hair. Shui shu can also result in hair loss, poor hair growth, dry hair, or brittle hair. This is typically seen after childbirth and menstruation. Phlegm, damp heat, and dampness can make the hair greasy. The scalp can also be itchy when there is damp heat. Dampness and phlegm can also block blood from nourishing the hair so that it starts to fall out. A person can also suffer hair loss when heat scorches the roots of the hair. The heat may be generated internally, or there may be invasions of wind heat. If it is due to wind heat, the hair loss will be sudden and defined patches will be missing. Let's go to the nails. They are an aspect of the liver in the same way that the tendons are. Nails are nourished by liver blood. Nails that are weak, break easily, or are soft or rigid, or are a sign that liver blood is not nourishing the nails. If the nails are very thick and yellowish, this can be a sign of liver blood stagnation or dampness. Typically, this is seen in the toenails because dampness seeps downwards. Skin, hair, and nails observation and significance. For dry skin, there's shui stagnation. Greasy skin, damp heat, and phlegm. For itchy skin, there's wind dampness, dryness, and blood stagnation. Hair loss and baldness, significance is jingshu, shui shu, fire, wind heat, dampness, and phlegm. Dry hair, blood shu, greasy hair, damp heat, and phlegm. Oily, itchy scalp means damp heat. Very thick nails means blood stagnation. Weak, soft nails that break easily is a liver blood shu. Rigid fingernails, significance is liver blood shu. Thank you for your attention.
Now let's go to diagnosis according to pathogenic Qi. Shui stagnation, part 2. The heart has the function of governing blood. The heart can easily be affected by blood stagnation, which will manifest as a sharp pain in the chest and a disturbance of the cardiac rhythm. Stagnated blood does not have any of the nourishing qualities of blood. On the contrary, blood stagnation blocks fresh, nutritious blood from circulating through an area. This can result in the skin above an area where there's stagnated blood being dry, flaking, or thickened. There may also be changes in skin pigmentation. By blocking the circulation of blood in area, blood stagnation will prevent shen, which is anchored by and thereby circulates together with blood, from flowing through the area. This can result in a sensation of numbness. This is typically seen when there is scar tissue. The stagnated blood from the trauma or the operation will have accumulated in the tissue around the operation site or the injured area. The tissue is often hard and thickened, and there is either numbness or sensory disturbance in the area, all of which are characteristics of blood stagnation. Stagnated blood moves more slowly, if at all, and is therefore less oxygenated. This can be seen in generalized signs such as a dark facial complexion, dark lips, dark or purple nails, purple tongue, and swollen veins on the underside of the tongue. Wherever there is tissue, skin, or blood vessels that are purple in color, this is a sign of blood stagnation. Typical examples of this are bruising, varicose veins, and spider nevi, but it could also be the tissue around the joint. The pulse can be choppy, wiry, or confined where there is blood stagnation. It can also be knotted if there is heat blood stagnation. On the mental emotional level, blood stagnation can impede the movement of shen. This may mean that the person is psychotic, depressed, or has difficulty staying awake. The symptoms and signs are sharp pain that is localized in one place, pain that is sharp, piercing, or stabbing, pain that is worse at night or after the person has been physically inactive, limited or stiff movements, bleeding, long menstrual cycle, painful menstrual bleeding, dark and clotted menstrual blood, sharp chest pains, irregular cardiac rhythm, dark facial complexion, altered pigmentation, dark lips, dark nails, rough and flaky, thickened or dry skin, physical lumps and knots in the body's tissue, numbness or sensory disturbances, purple skin, purple blood vessels, depression, and the ear is tender or painful when it is bent, doubled, and squeezed. Purple or dusky tongue, swollen purple sublingual veins, choppy, wiry, and confined or knotted pulse. The key symptoms: sharp, piercing, or stabbing pain, limited or stiff movements, dark lips, swollen, purple sublingual veins. Treatment principle: circulate blood and disperse blood stagnation. Acupuncture points to choose from are UB17, spleen 6, spleen 10, and Jingwell points and local points. A needling technique to be used is draining. Bleed Jingwell points and small purple vessels in the skin. The use of cupping, moxa, guasha, and 7-star needles is also relevant. Explanation is UB17, spleen 6, and spleen 10 move blood in general. Jingwell points activate blood in their own channel when they are bled. And bleeding spider nevi and stagnated blood vessels disperse blood stagnation in the local area. Relevant advice. As with phlegm, it is vital that the underlying pattern that has been involved in the creation of blood stagnation is addressed. Blood stagnation can prevent the circulation of Wei Qi in an area where there has been a physical trauma. It is therefore important that this area is protected from the environment, so wind, cold, and dampness cannot invade the area. It is typical that joints that have been injured or operated are often sensitive to changes in the weather. Physical activity is beneficial because it will circulate qi and blood, but it's also important not to overburden the area or force a joint to move more than it will. A joint or a limb should not be forced to move beyond the spot where there is a sharp pain, because doing so may cause further blood stagnation. Blood stagnation can be caused by the following patterns of imbalance. There's qi stagnation, phlegm, blood deficiency, qi deficiency, cold, heat. And the blood stagnation can result in the following patterns: qi stagnation, heat, phlegm, and blood deficiency. Thank you for your attention.
Diagnosis according to 4 levels. This time we discuss qi level heat. Qi level heat can arise because there has been a direct invasion of exogenous pathogenic qi in the qi level, or because exogenous pathogenic qi has penetrated deeper from the Hui level. Exogenous pathogenic qi can penetrate deeper to the next level if it is strong enough or if the previous level has been treated incorrectly or inadequately. This pattern will develop more rapidly and the symptoms will be stronger in a person who already has an excess heat condition. When there is a qi level disorder, both pathogenic qi and Chen qi are strong. This will result in pronounced excess heat symptoms. Qi level disorders are differentiated according to which organ is affected. There are many subcategories which mainly have relevance when using herbal medicine. The most relevant patterns for acupuncturists are described. The pathogenic heat will itself disturb the qi in the interior, and the heat will drive yang qi upwards and outwards. This is further reinforced by the extreme heat that arises as a consequence of the struggle between Cheng qi and pathogenic qi. This results in the generalized symptoms and signs that are seen in this level. These are very similar to the symptoms and signs that are seen in the Yangming stage of the 6 stages, and these 2 stages and levels are also overlapping. Shaoyang stage symptoms can also be differentiated as qi level heat. The generalized symptoms and signs of this level are fever with an aversion to heat but not to cold. There is no aversion to cold because the pathogenic qi no longer disrupts the functioning of Wei qi. On the other hand, there is so much heat in the body that the person has an aversion to heat. Heat injures fluids, and this results in a great thirst with a desire for cold drinks. The urine will be dark. There may be profuse sweating due to the heat, but there can also be a lack of sweating because the fluids are exhausted. The extreme heat can ascend to the heart and agitate the shen. This can be seen when the person is restless and irritable. There is a bitter taste in the mouth and a thick dry yellow coating on the tongue. The pulse will be rapid and full. Qi level heat should be further differentiated with regard to which organ is affected. Each organ pattern will manifest with specific symptoms and signs that reflect the disturbance of its functions. Heat can easily injure yin. This will manifest with symptoms and signs of yin deficiency. There can also be simultaneous Wei and Qi level heat with a resultant mixture of symptoms and signs from both levels. Invasions of exogenous heat that have not been expelled from the Wei level or that have been treated incorrectly or inadequately is the etiology of qi level heat. Direct invasions of heat to the qi level after being exposed to exogenous pathogenic qi. Symptoms and signs. There will be high fever with no aversion to cold, profuse sweating or no sweating if the heat has damaged fluids, extreme thirst with a desire for cold drinks, red face, restlessness, and irritability. The skin may feel warm to the touch, restless sleep with violent dreams, red tongue with dry yellow coating, rapid full flooding pulse. Key symptoms, high fever with no aversion to cold, profuse sweating and thirst, rapid and flooding pulse. Treatment principle, drain heat. Acupuncture points, choose from LI 11 and 214. Needling technique is draining, we bleed 214. LI 11 and 214 drain heat from the qi level. The person should avoid consuming food and beverages that will create additional heat in the body. Qi level heat can be caused by Wei level heat. Qi level heat can result in Yin level heat and Shui level heat. The treatment will be most effective if it is possible to differentiate where in the qi level the heat is. The heat can be located in one or more Zangfu organs, in which case there will be symptoms and signs that are specific to these organs. The treatment will then be focused on draining heat from these organs. Thank you very much for your attention.
Let's discuss combining points principles, the balancing left and right. An example of unilateral needling could be the needling of PCA6 on the right side and liver 3 on the left. Liver 3 eliminates stagnation of liver, qi or blood, and pericardium 6 moves blood and calms the mind. The combination of these 2 points can therefore eliminate stagnation of liver qi or blood, particularly if it derives from bottling up of emotional problems. Very often, this situation is also accompanied by a deficiency of stomach and spleen, which may arise independently as a result of invasion of stagnation liver qi to stomach and spleen. In such cases, one could combine the needling of pericardium 6 on one side, liver 3 on the other, and stomach 36 and spleen 6 bilaterally. The combination of these 4 points with 6 needles instead of 8 can tonify the stomach and spleen, calm the mind, and eliminate stagnation of liver qi or blood. So we have here the illustration, the left-right combination of pericardium 6 and liver 3 with stomach 36 and spleen 6. Another example could be the combination of pericardium 6 on one side and stomach 40 on the other. Pericardium 6 harmonizes the stomach, and stomach 40 calms the stomach in excess patterns. This combination has a good effect in treating stomach problems of excess nature. Besides its effect on the stomach, this particular combination is also used for acute bruising of the rib cage. So here is the illustration of a left-right combination of pericardium 6 and stomach 40. Unilateral needling is particularly effective when using 2 channels of the same polarity, one of the arm, the other of the leg. For example, triple burner and gallbladder, the lesser yang, pericardium and liver, the terminal yin, and so on. For example, one can use TB5 on one side and GB43 on the other for lesser yang type of headaches, or LI4 and stomach 36 for bright yang headaches. The method of using unilateral needling on positions on arm and leg channels for the same polarity can be used in the treatment of sprains as illustrated above, and become combined with the method of using the opposite side. For example, in sprain of the right wrist with tenderness on TB4, one would use GB40 on the left side. So using a point on the related leg channel of the same polarity on the opposite side to the sprain side. So we have here illustration, figure 70.12, the shoulder, hip, elbow, knee, and wrist ankle correspondence in bright yang channel, and figure 70.13, the cross needling on shoulder, hip, elbow, knee, and wrist ankle correspondence in bright yang channels. Thank you for your attention.
Let's now go to diagnosis according to Zhang Fu organ patterns with the pattern stomach qi deficiency and cold. Stomach qi deficiency and cold is a sub-pattern of stomach qi deficiency. In these cases, there is both stomach qi deficiency and an aspect of yang deficiency. In addition to stomach qi deficiency symptoms, there will be signs that the transformation of food and liquids is not functioning optimally due to a lack of physiological heat. Now let's take a look to its etiology. In addition to the factors discussed under stomach qi deficiency, there can also be an excessive consumption of food and beverages that have a cold energy or are physically cold. This can create cold in the stomach. Typical examples of this are things like ice cream, iced water, salads, raw vegetables, and tropical fruits. Invasions by exogenous cold can damage stomach qi when there have been repeated invasions or if the cold has not been completely expelled. Medicine that has a cold dynamic can also be involved in the generation of this pattern. Now let's go to the symptoms and signs. There will be a watery vomit, preference for warm food and beverages, lack of thirst, cold and weak limbs, discomfort in the abdomen, fatigue, pale face, and aversion to cold. The epigastric region can feel cold and palpated. The person may dress warmer than is normal for the season. The tongue is pale, wet, and swollen, and the pulse is deep, weak, and slow, especially in the right one position. The key symptoms here are cold lips, a preference for warm food and beverages, fatigue, and a pale tongue. For the treatment principle, we warm and tonify stomach chi. For the acupuncture points, we can choose from stomach 36, spleen 6, ren 6, ren 12, UB20, and UB21. And use the tonify needle technique, and moxa is also recommended. To further explain the choice of points, stomach 36, spleen 6, ren 12, UB20 and UB21 tonify stomach chi, and ren 6 warms the yang. As a relevant advice, in this pattern, it is advisable to consume food and beverages that are both nutritious and warming. The use of ginger is particularly recommended. The patient should try to eat frequently and regularly. They should avoid eating too much at a time so they don't create a stagnation of the food in the stomach. Similarly, they should try not to snack constantly and nibble at food. They should also, as far as possible, avoid consuming food and beverages that are cold, both physically or energetically, such as ice cream, iced water, and cold drinks, salad, and raw vegetables, as well as too much fruit, especially tropical fruits. Stomach chi deficiency and cold can be caused by the following patterns of imbalance: stomach chi deficiency, spleen chi deficiency, spleen yang deficiency, and invasion of exogenous cold. In turn, it can result to spleen yang deficiency, stomach spleen deficiency, stomach and spleen chi deficiency, phlegm, food stagnation, and blood stagnation. Thank you for your attention.
Diagnosis according to Shi, Shui, Jinye imbalances. Shui stagnation part 2. Etiology. Shui stagnation can arise as a consequence of virtually all chronic patterns of imbalances. Qi stagnation, heat, cold, phlegm, qi shu, and shui shu are often precursors of shui stagnation. Physical traumas and operations always create a stagnation of shui. Symptoms and signs of these are sharp pain that are localized to one place, pain that is sharp, piercing, or stabbing, pain that is worse at night or after the person has been physically inactive, limited or stiff movements, bleeding, long menstrual cycles, painful menstrual bleeding, dark and clotted menstrual blood, sharp chest pain, irregular cardiac rhythm, dark facial complexion, altered pigmentation, dark lips, dark nails, rough, flaky, thickened, or dry skin, physical lumps and knots in the body's tissue, numbness or sensory disturbances, purple skin, purple blood vessels, navy or varicose veins, psychosis, depressions. The ear is tender or painful when it is bent, doubled, and squeezed. Purple or dusky tongue, swollen purple sublingual veins, choppy, wiry, confined, or knotted pulse. Key symptoms are sharp piercing or stabbing pain, limited or stiff movements, dark lips, swollen purple sublingual veins. The treatment principle would be to circulate shui, disperse shui stagnation. The acupuncture points is to choose from urinary bladder 17, spleen 6, spleen 10, which are Jingwell points and local points. The needling technique would be to drain, bleed Jingwell points and small purple vessels in the skin. The use of cupping, moxa, gua sha, and 7-star needles is also relevant. Further explanation would be to use urinary bladder 17, spleen 6, and spleen 10 to move shui in general. Jingwell points activate shui in their own channel when they are bled. Bleeding spider, navy, and stagnated blood vessels disperse shui stagnation in the local area. Relevant advice. As with phlegm, it is vital that the underlying pattern that has been involved in the creation of blood stagnation is addressed. Shui stagnation can prevent the circulation of wei qi in an area where there has been a physical trauma. It is therefore important that this area is protected from the environment. So wind, cold, and dampness cannot invade the area. It is typical that joints where there has been an injury or an operation are often sensitive to changes in the weather. Physical activity is beneficial because it will circulate qi and shui, but it is also important not to overburden the area or force a joint to move more than it will. A joint or a limb should not be forced to move beyond a spot where a sharp pain is experienced. Doing so may cause further blood stagnation. Blood stagnation can be caused by the following patterns of imbalance: qi stagnation, phlegm, shui shu, qi shu, cold, heat. Shui stagnation can result in the following patterns of imbalance: qi stagnation, heat, phlegm, and shui shu. Thank you for your attention.
Now let's talk about case history 6 and 7, depression. Case history: a 73-year-old man had been suffering from depression for many years. He complained of feeling depressed. A certain family situation was causing him great frustration and resentment, but he did not show any willingness to elaborate on that or to want to discuss it. Physically, he was in remarkably good health, complaining only of some constipation and abdominal pain. He was not on any medication. His tongue was quite normal, except for being red on the sides. His pulse was wiry in all positions. The diagnosis: this is a very clear example of depression occurring against a background of liver qi stagnation deriving from repressed anger, frustration, and resentment. The redness on the sides of the tongue reflects heat deriving from liver qi stagnation, while the wiry quality of the pulse in all positions is a clear indication of liver qi stagnation. The stagnation of liver qi restrains the coming and going of the ethereal soul and caused him to feel depressed. Another case history: a 35-year-old woman had been suffering from depression for 7 years. She felt very depressed all the time, was sad, and cried frequently. The problem started after the breakup of a relationship 8 years previously. She had found this breakup very painful, and she had an intense feeling of rejection and loss. She had never recovered from this breakup and had not been in another relationship since then. She was pale and had a sad expression, and she spoke with a very low voice. She sometimes experienced a dry mouth, palpitations, and slight breathlessness. Her tongue was pale and the coating was missing in patches. Her pulse was very weak on the right front position and floating empty on the left side. The diagnosis: her symptoms, pulse, and tongue all clearly point to a deficiency of lung qi and lung yin. The symptoms indicating deficiency of the lungs are crying, pale face, sadness, weak voice, and a slight breathlessness. The lack of coating and patches on the tongue indicates yin deficiency. There is also a deficiency of the heart as evidenced by the palpitations. In summary, there is therefore a deficiency of qi and yin of both heart and lungs. Thank you for your attention.